It is a chronic condition that often causes extreme redness on the face. This morning we're talking about rosacea. And to tell us more about this condition is Dr. Cohen with About Skin Dermatology. Thanks so much for being here.
My pleasure.
Okay, so let's just first talk off about those who have rosacea know all about it, but someone who may not have it, explain what rosacea is.
Rosacea is a very common skin condition affecting adults, usually fair-complected adults of northeastern European ancestry. And really, we see central facial redness, we see acne-like lesions, and people usually complain of burning and stinging as well.
And I know there are different stages when it comes to rosacea. We've got a big spectrum of them. We actually have some photos that we can kind of go through and talk about what we're seeing. Describe what we're looking at here.
So this is something called rhinophyma, which is a rubbery-like changes that happen with significant rosacea over a long period of time. But it's important to realize that, as you said, rosacea is a spectrum. It starts with central facial redness, and if you look closely, there's very prominent blood vessels. And then the second component is rosacea that has inflammatory lesions like this.
Wow.
Patients have little acneiform lesions, or more significant, what we call type 3 nodular lesions, such as this.
Okay. And you said sometimes it can be somewhat painful.
Very painful for many people, and we do know that there is a lot of stimuli that can be associated with flares. So warm beverages, spicy foods, alcohol, chefs that are overheat for long periods of time, they can flare, and the burning symptoms and the redness and the flushing can become quite painful. Okay,
so it's easy to avoid maybe certain activities, but some people just get rosacea all the time no matter what they are doing. What can they do?
You know, there are some very simple things that can be done. The former chairman of Mayo Clinic in Scottsdale wrote an article on really just sucking on an ice cube to prevent that central facial flushing. But really the mainstay of treatment is topical antibiotics for the less significant type of rosacea, and then for the more cystic and nodule component, oral antibiotics. And then there are lasers to really effectively treat the central facial redness, and those are very effective lasers called pulse dye laser. There's a newer laser called a Max G, which we have. And then for people, as we saw, those rubbery type changes, those people need laser resurfacing. They really need to peel off those areas so that it's much more cosmetically appropriate.
Yeah. Okay. All right. Lots of great tips. And of course, there's way more than we could possibly detail right here. So to find a link to About Skin Dermatology, go to our website, thedenverchannel.com. Click on that big red TV button.